early morning to mid-morning. That's Monday through Thursday, because then they can write it up. Hi, Charlotte.
Hi, nice to meet you.
Who's been encouraging me.
We have Chris Smith. Many of you already know Chris. He's a very engaging, dynamic speaker who knows an awful lot about the issues that he's going to discuss, and even more about Mike Bishop. So, welcome, Chris. Thank you. Thank you for the opportunity. Got to find you won't make it. Yeah, it's going to blow out. Okay, I'll do it now. I just got to get the mic in a spot where you can hear me. I think I'm at a good spot now, right?
Yeah.
Can't hear me? Can you hear me?
Yeah.
All right. Certainly, this is a disheartening moment in many ways, and it's been very disheartening for a number of reasons. I look at what happened with the vote on the Trump Care, Ryan Care, Bishop Care effort to repeal and replace. And I'm embarrassed that it was a congressman from Michigan who resuscitated it, Fred Upton. I'm embarrassed we have a president who understands so little about health care that one day he's celebrating in the Rose Garden a vote that would take health care coverage away from more than 24 million people. And the next day he's complimenting the Prime Minister of Australia on their great system. And they have universal health care.
He doesn't know what he's talking about.
He doesn't know what he's talking about. And for us in the 8th District, it's a challenge, because not only do we have to educate people about the policy issue related to health care, but we have to overcome the stream of misstatements and false reassurances that we get from our representative in Congress. And of course, Rick Arty has mentioned things like, and other speakers at other events, the promise not to pull the rug out from under anybody, and then voting for something that the Congressional Budget Office says will take away from 24 million people, and that's not even counting the pre-existing condition issue. I have a couple of quotes, and I want to get them just right. In a press release, when he celebrated voting for the AHCA, Bishop's press release said, House Republicans are delivering on the promise to make health care work for everyone.
Liar.
Nothing could be further from the truth. And this is what we have to fight against. And this is why I say now, and I will keep saying for the next 18 months, don't listen to what he says. Look at what he does. It's especially important with him. One of the other things he bragged about in the press release, and he bragged about it, was what he called, quote, Medicaid entitlement reform. And he bragged that it was the first time in history there had been Medicaid entitlement reform. But be aware and educate others, what does it mean to say entitlement reform? That is a benign sounding word that, if you were honest, really means taking away the basic necessities of life from the most vulnerable people in our society. That's what entitlement reform is. And when you talk about Medicaid retirement reform, you're talking about a program where half of the recipients are children and another quarter are a combination of seniors and people with disabilities. And that's who's going to suffer in the process. Pre-existing conditions. I wrote a blog piece today, some of you may have seen, where Bishop tweeted an article from National Review. And he said, for those of us who criticize him, that we are perpetrating a big lie in the politics of fear. And he wants to claim that what they've just done in opening vulnerabilities for people with pre-existing conditions is not going to hurt hardly anybody. Indeed, in the article, it talked about, oh, it's just going to be a fraction of a fraction of a fraction of the population. This was a protection that existed to make it that even one person suffers adverse consequences. That's too many. And that's why I know you're here, and that's why we need to speak out against this. Let me give you another quote, and this comes from Bishop in a press release, and it comes from, well, his press release said, see if you agree with this, "We have made it a priority to strengthen protections for patients with pre-existing conditions." That's what he said.
Liar.
And then, as a lot of you know, because it was in the letter he sent to lots of constituents who had communicated with him about this issue, and from his press release, he said, quote, "By incentivizing individuals to maintain coverage, the AHCA ensures that insurance companies will not be able to deny, rescind, or raise the cost of coverage for a patient with pre-existing conditions." He states this as a certainty, that somehow the concept of incentivizing is a guarantee of protection. And what came to my mind was a kind of analogy or vision. Picture this. Picture you have an array of trees that have a single branch sticking out over a sheer cliff of the Grand Canyon. And that Bishop and his colleagues would take people with pre-existing conditions and take them out on this branch and say to them, "Don't worry, there's a few nets down there somewhere that are going to catch some of you." Because, as Rick said, the money they're allocating for high-risk pools is not nearly enough based on what any expert says. And then picture Bishop having put people with pre-existing conditions out there and turning and walking away and looking back over his shoulder and saying, "Don't fall." And disappearing without caring at all about whether anybody falls or not.
Right.
Because he's now incentivized them not to fall. But this shows no understanding or awareness of the real world, because if you're standing out on a branch over a cliff, and there's high winds, and there's rain, and there's individuals who don't have the strength, namely the money, to pay for a continuation of health care, right? People are going to fall all over the place now that you've opened the door in those states where they have these waivers. And now I'm going to get a little bit personal. And those of you who heard me speak in Howell, I got personal and talk about my father, but I'm going to talk about my sister-in-law. Because it illustrates there are lots of reasons that people may not be able to continue their coverage. And they have pre-existing conditions, and they will suffer severe consequences. My sister-in-law was working a low-wage job in another state. She had health care, but then she needed to escape from an abusive husband. And she made the decision, which we were happy to say finally, to make her escape. When he went off to work, someone came and helped her get her personal possessions out of the house, and she fled the state. So she lost her job. She lost her health care coverage. This is back in 2008. There was no Obamacare. She has pre-existing conditions. She's back in Michigan looking for work. She's someone who didn't go to college. So you're in your early 40s. You're trying to find work, right?
Right.
You have no money. there's no way she could have paid for a continuation of coverage. There's no way.
Not right.
Bishop doesn't recognize this. For the affluent, oh, just pay for continuation of coverage. It's not that easy. She had to escape. Bear this in mind. Many people who suffer some crisis in life and some disadvantage are going to react with determination to try to handle it for themselves. And that's the kind of person she was. So she looked for a job and she looked for a job, and unbeknownst to us, she was suffering medical symptoms. But she was too proud to raise this. She was too proud to ask for help. And by the time she ends up in the emergency room in the hospital, she's diagnosed with stage 4 colon cancer. A colonoscopy costs, on average, $1,600. If she had lived in a moment in our country where health care was available, she would have felt free to go to the doctor. She would have felt free to not feel like she had to have the money to pay. But she didn't. And what happens next? Now she's in the hospital, they qualify her for Medicaid, and it ends up spending several $100,000, I imagine, in a fruitless effort to save her life, and she dies at the age of 44. That story, I think, has a number of messages for all of us. One, of course, is that Bishop is wrong in just assuming that by incentivizing that people can afford to continue their coverage. But it also illustrates there are very serious human consequences on the horizon, not just for someone with pre-existing conditions, but for the 24 million people that the Congressional Budget Office says will be knocked off of their health care. And think about not just the tragic human cost of something like that, how much she suffered, the fact that our family doesn't want anybody else's family to experience what we went through. But think about the economic insanity of having a system where someone is not able to get a $1,600 colonoscopy that might detect and lead to life-saving treatment. And instead, as a society, we pay a couple $100,000 when it is too late. That makes no sense in human terms. It makes no sense in economic terms. The candle, if I had it here, for us it is literally for remembrance, as well as our concern about our fellow Americans who will suffer in the process. But as a secondary matter, that candle and the flame, to me at this moment, is also about our democracy. And the fact that with democracy, you have to keep that flame alive. You have to nurture it. You have to protect it. You have to defend it. So we have much to do, and we know what struggle lies ahead. And we know Mike Bishop is an obstacle and an opponent, but it's good to see people recognizing what's going on. It's good to see people remembering and caring. And it's good to see that people are going to join together to try to reverse what's happening, defend our democracy, and work toward the goal of having health care available for all